Our mission is very straightforward. We want to make quality health care access affordable to anyone who needs it. If we're going to have a healthy state, a healthy community, we've got to have healthy people. And prevention and primary care is a key ingredient to the state's overall health. If we have access to primary and prevention from newborns all the way through teenagers, through their early adult life, then it's more likely that person will be healthy as they age. When the times are such as they are now, and economic times are very questionable, the state is having difficulty at the state level, certainly at the federal level, things are very unstable. But for a family living in poverty, they need something stable, and Variety Care is one of those stable things that they can depend on. We see any patient who needs access to care, but a lot of the patients we see are uninsured, and those patients pay on a sliding fee based on their household income and size. The less money they make and the more people in the household, the lower their cost. Our nominal fees then are for people who live at 100% of poverty or below. To provide access to affordable care is something that needs to be there day in, day out, Monday through Friday, weekends, whenever they need access. And we want to make sure that people have access to their primary care provider, the same provider every time, so a relationship is built. We want to make sure that that patient needs access to nutrition services, or that patient needs access to a clinical pharmacist, or they need to get their teeth cleaned, or they need whatever the patient needs in terms of primary care. We want to make that all available under one roof.
Variety Care is more than just sick care because we focus on the entire patient, the whole patient. One thing that I think is really cool about Variety Care is we really work on prevention, and I think that's especially important in women's health care. I think women's health is really the key to a successful family, because if you think about it, women tend to sacrifice for their families. And so when families are sick, women are going to be the first to sacrifice their own health to bring their children, their husbands, the others. And so if we can provide full scope care and allow women to be healthy so that they can provide care to their children, to their spouses, and they're healthy while they're doing it, they're going to lead a healthier, happier life. They're going to also be able to focus on their families more instead of worrying about their own health issues if they're able to be healthy while they're providing for their families. The healthy child begins in pregnancy, and so if we can provide healthy prenatal care for our moms, that actually starts that child on a very good trajectory for healthy outcomes. We now know that childhood obesity and asthma and some of the long-term life outcomes actually can be linked back to a healthy prenatal care as well, and that's really key to us being able to provide that care to moms so that these kids can get a really good, strong start.
What we do here is something really unique in that we have a clinic specifically for newborns, but it's also an open access clinic, meaning that if a patient with a new baby wants to walk in without an appointment, they will be seen at this clinic. And that is something that no one else in town is doing that we know of, specifically for newborns. If their baby is ill, if they need to get in, all they really have to do is come to our clinic and we will see them as quickly as we can that day. I think when you talk to families, they will tell you that they feel very comfortable coming to this clinic.
From the very beginning of life to the very end of life, Variety Care can take care of the individual and the whole family. We offer a lot of programs here with women's health. If we treat the mom, once the mom has the baby, they go to our pediatrics. So we have one particular patient that we saw during her pregnancy. She had that child, and I followed that child here through her pregnancy, and now she has a child. And so I think that's really cool having those generations here. And the mom still comes to see us for her regular annual exams, and that's important at her age also because we can send her for mammograms and do lab work and just make sure that she continues to stay healthy.
So my mom was attended by Georgie whenever she was pregnant with our youngest sister. And then I was taken care by Georgie in both of my pregnancies as well. You can tell when people care about you. You know, they talk to you differently. They show a genuine concern. It's special because you feel a connection on a different level. You feel more at ease at expressing your concerns and knowing that you're in good hands, that they're looking out for you. They're great people. Healthcare is something very important. I want my kids to be healthy and to grow healthy, and I want to have a big healthy baby, you know, whenever they grow up and have a healthy lifestyle. Variety Care is that starting point.
Dentistry is one of the fields that is very closely tied to people's self-confidence. When a patient is healthy and when a patient is taken care of and feels secure, they feel like they can go out in the community and they can get jobs and they can meet people and they can start making a difference themselves, and it's wonderful to see. I have one patient in particular that I made dentures for several months ago, and he hadn't been in the workforce in a long time, and a big reason was because he was just really embarrassed about his smile.
I had the surgery and accidents and lost some of my teeth. I came to Dr. Morrison. I really had basically hardly any front teeth. With their support and just putting some efforts, we ended up getting the nice smile. And I'm so thankful to her and to Variety Care. By simply being more presentable here, can make improvement in your mental health as well. Dental work is very expensive. In Variety Care, they said, how can we take care of this? I wouldn't be able to communicate, smile, and be an active member of my society if it wasn't for her. And I'm so thankful to her. She's doing the same thing as a silent hero right here in Oklahoma. And this goes for many other doctors within Variety Care. And that's why I'm so thankful and grateful to this organization. There are other fine organizations, but my favorite ended up to be Variety Care.